Okay.
Remote work is efficient in a lot of ways, but one of the side effects are that it produces isolation by accident. Their entire professional experience is a laptop screen and a recurring stand up, which means connections and relationships rarely happen. Most organizations respond to this problem with a virtual happy hour and emails. So now we have Samantha Levin, the Wellness Program Manager at Wellness 360, to help us understand how to approach designing programs for social wellness. So let me start with the first question. Loneliness has been identified as a global health pandemic, but what actually does chronic workplace loneliness do to the body and the brain?
Yeah, great question. So it's a lot more serious than people realize. Chronic loneliness activates the body's stress response, and that same system that kicks in when you feel physically threatened. So over time, that leads to elevated cortisol, immune suppression, and kind of like a mental drain from that constant, scanning your environment for social threats. So the US Surgeon General actually issued a formal advisory in 2023 classifying loneliness as a public health epidemic. This isn't about someone feeling left out of like a happy hour or some type of like social situation. We're talking about real psychological consequences. So, absolutely, loneliness is a lot more serious, I think, than people really realize. So, I'm glad we're talking about this today.
So that I just have another question. So social wellness is a problem, but how do we tackle that? So there are many activities that if you randomly search online, you'll get 20 activities, 30 activities. So what is the difference between social activity and social wellness?
Yeah, great question. So, social activity is more of like what's on the calendar, and social wellness is what people actually feel. So, you
Mhm.
can have a packed event schedule and still have a team full of people who feel invisible. So, what we're really, after is belonging, trust, and that sense that your colleague actually knows you, right? And you have that sense
Mhm.
of trust and that safe space built between you two. Those things don't come from, a scheduled Zoom. They come from repeated, maybe low stake moments where people get to show themselves. So that's a very different, design goal there. So kind of that little bit of differentiation. A lot of, wellness programs are definitely, gearing things also towards like social wellness as well. Definitely one of our eight dimensions of wellness.
Okay. One way is that, like I was talking about previously, so most organizations they go to the easiest approach. So there's virtual happy hours or Slack channels. So is this a proper clinical solution to this problem?
There, I would say maybe more like tactics, not programs, and there's a
Mhm.
big difference. A one-off event is a social performance. People have to
Mhm.
show up, be engaging, and it can actually feel more isolating if you're maybe already struggling, maybe you're not having like the best day yourself. The research on loneliness is clear. The problem isn't a lack of social contact, it's a lack of perceived social value. So, feeling like you matter to the people around you is really huge. So, happy hour doesn't really solve that. Maybe more of like, a structured mentorship, peer accountability. Those groups, maybe collaborative challenges, things that actually build relationship infrastructure over time, not just filling up a Thursday afternoon because you have to, because management says so, right?
I did get a lot of practical ideas out of your answer. So yeah. When do you notice that this is a problem? So what is the trigger behind the recognizing this is something that we need to fix? What is the trigger that tells that to the leaders and the HR people?
Yeah, maybe, starting with onboarding, that's the highest like leverage moment. That first 90 days really shapes how you connect with someone and your team and how you feel that sense of belonging in that environment that you work in. So maybe a, cohort based onboarding system, helps to also create relationship, and those anchors from day one. So beyond that, peer recognition systems that make it easy to see colleagues across teams, doing good work and supporting them. Even those interest-based communities that cut across, many different organizations, management training uh, on these social situations, because a lot of isolation happens at that team level, and managers, either catch it or they don't. So, through the line, it's really helping, you want to make connections and have those be normalized, reoccurring and those low barriers. So making it easy and accessible for your team to really create that sense of community, even if it's just a small moment throughout the day or throughout the week. So it does not have to be a big production.
Okay, so what are the indicators that this is a problem? So how do you
um,
know? Yeah.
yeah. Great question. Usually something forces the issue, so maybe like a turnover spike that shows up in maybe exit interviews or an engagement survey where belonging scores, maybe rank super low. Um, a manager escalates because, half their team seems like checked out and not really there or wanting to engage. So the trigger is almost always, pain that shows up in a metric. The challenge is that by the time you're seeing it in the data, the isolation has been building up for a while. The organizations that get ahead of it are the ones treating social wellness as an infrastructure from the start, not a response to the crisis. So, yeah.
No, I really like the way that you worded it as pain because, yeah, it is no environmental wellness, social wellness. These are usually overlooked aspects of the eight pillars. So, yeah, it is pain in a way. And yeah, so when you're pitching ideas related to social wellness, what objections do you hear from the team?
Um, the first one is our people are always connected. We do team lunches and have a great Slack channel. And my answer is always the same, activity isn't connection. So presence isn't belonging. You could have a fully booked, social calendar, kind of like I mentioned earlier, and still feel completely invisible. If none of those, interactions feel real or reciprocated, the second objection is ROI. And honestly, that one I welcome because the data is strong, consistency shows up, that employees with, a best friend at work are more engaged and less likely to leave and maybe more productive, right? So that's not, a soft wellness claim, that's retention and performance data.
Yeah, makes sense. So, if, like you said, if a team has a very good social wellness infrastructure in place, how do they know if their initiatives are actually working, that they're actually producing the results that we need?
Yeah, so you definitely need three types of data together, not just one. So first you want like those like self-reports, maybe some pulse surveys asking specifically about belonging, quality of peer relationships, feeling seen and known by your colleagues. Secondly, I would say, that behavioral data, so participation, maybe in collaborative challenges, peer recognition, activities, community engagement groups. And then maybe that third type of data would be those proxy outcomes, absentee trends, retention. If belonging scores are rising, peer recognition is up and retention is improving in the same cohort. You have a real signal there. The mistake I see constantly is organizations counting, heads at social events and calling that data. That really doesn't tell you much, right? Not really like diving deep into those individuals and how they're actually feeling.
Yeah. Um, so what you said is true. You cannot count headcount and call it participation or engagement. So is there any client story that illustrates what is possible when social wellness is taken seriously?
Um, yeah, the pattern I see with mid-sized companies going through maybe rapid growth, saying from like 200 employees to 800 employees in 18 months, the founding culture with that tight knit is everyone knows each other, right? Then the scale is broke. You're adding so many employees, and leadership couldn't figure out why engagement was dropping, even though the comps and benefits actually improved. So what
Mhm.
happened was the social infrastructure didn't scale with the headcount. So the fix wasn't more perks; it was more deliberate community infrastructure, and building those that sense of belonging with your employees. So, cohort onboarding, cross team recognition systems,
Mhm.
specific interest groups and communities. So within 2 quarters, engagement recovered, not because the work changed, because people felt like they belonged to something again.
Sure. Uh, so another question I had was surveillance and productivity monitoring have increased in remote environments. There are 100 plugins that track how much time you've spent on your laptop, what sites you're looking at. So what does behavioral science tell us about how that affects social trust and team cohesion?
I think it does real damage, when you're tracking online hours and your mouse
Mm-hmm.
movements, you're sending a signal that we don't trust you. And that signal is incompatible with psychological safety, right? So, which is the foundation of social wellness. It's built on social wellness, that psychological safety. So people don't open up, they don't take risks or build real relationships in environments where they feel monitored.
Mm-hmm.
Technology should be doing the opposite, right? Making it
Yes.
easier for people to see each other, recognize each other, collaborate across distance. So when it becomes a surveillance tool instead of, making it easier for individuals, it's, actively undermining the thing that you're trying to build.
Thank you so much for your time.